Welcome to another podcast of Stories and Innovations in ALS with Lisa Deegan, and I'm McFinn at everythingals.org.
Welcome to Stories and Innovations in ALS, episode number 15, Passion, Perseverance, and Advocacy. My name is Lisa Deegan. I'm joined today with McFinn. We're storytellers who've both been affected by ALS. Our mission is to share the stories of those also affected and the efforts of those who are investigating and innovating to find a cure for this devastating disease. We are part of an organization called everythingals.org, whose mission is care to cure with the ultimate goal of accelerating treatments for ALS. Today, we are excited to have the opportunity to talk with Austen Eadie-Friedmann, who just so happens to be the newest member of the Everything ALS team. So we're so excited to have him on board and to have the opportunity to talk with him today. Austen, thank you for being with us.
Thank you so much, Lisa and McFinn. I'm so thrilled to be here and to be joining the Everything ALS team.
Wonderful, Austen. Thank you for joining us, because the more pieces of the puzzle that get together, the answer will come quicker. So tell me, how did your journey begin with ALS?
Yeah, so, certainly don't have any family history. So when I did receive my ultimate diagnosis, it was a complete and utter shock, as it is with everybody who is diagnosed with ALS. My journey with the disease really began in January of 2019. I had just taken on a new job at a biotech company in Boston, had just moved there from New York. I had spent the last year previous to that focused on improving my health. I stopped drinking. I started exercising pretty intensely. I was going to the gym, lifting weights, training and shaping my mind and my soul. So that was very important to me, along with the work that I was doing. And I noticed very early in January, after I had already moved to Boston, one of those crisp winter days up on the East Coast, I decided to go out for a run. And, started out, there were no issues. About a mile into my run, I noticed that there was a slight weakness in my left knee. And it got so weak that I couldn't actually finish the run. So started and stopped multiple times, didn't think anything of it. Maybe I was fatigued. The move was a very intense one. I had just started a new job. Ignored it and walked home. This persisted for the coming weeks and months. I got to the point where I was still exercising quite vigorously, but was not doing it outside anymore. I needed to slowly move to the treadmill. And then on the treadmill, I needed to go from running to walking. And then couldn't even really walk on the treadmill anymore for more than 10 or so minutes, and transitioned to the elliptical. And the weakness continued. So getting to about July of that year.
And you have not seen a doctor at this point?
I had not seen a doctor about this at this point.
Wow.
Yeah.
Did you think, it's like everybody says?
I just thought it was fatigue. I thought that, there was, just some stiffness in my knee. Didn't think it was really all that crazy. Had some knee problems in my family. Not that that's genetic, but, necessarily, but I thought, it could just be that. But in July, I started falling. I developed what I didn't know at the time to be a foot drop. And so inexplicably, I'd be walking down the street and I would just trip. And, I've never been the most graceful person in the world. So that didn't seem to seem, that crazy to me. But the frequency increased. And so that's when I decided it was time to see a doctor. Went to my doctor, they ordered a bunch of tests, did a basic neurological exam and didn't seem to think that anything was out of the realm of normal health. But it persisted. So I was actually referred to a physical therapist because we thought, maybe it's,
Typical.
right, muscular. I'm gonna butcher this, but muscular skeletal. And so, went to 4 or 5 sessions with the physical therapist, and he noticed that I was continuing to decline. I was getting weaker. The exercises that we had started were doing very little.
And what is the time frame that we're looking at from the first day of running, where your knee was starting to act up, to this getting on board with the physical therapist?
So I would say January to July, and I was going consistently once a week to the physical therapist throughout July and August. And then at the end of August, the physical therapist said to me, what we're doing here is not working. I really do think that you either need to go back to your doctor or you need to go and see a neurologist. I think that this could be neurological. So that started the next phase of the journey, which was trying to get a referral to a neurologist, trying to get into one of the clinics in Boston, and hitting roadblocks all along the way. I called MGH because I knew that they had a world-class neurology practice, and I was told that it was going to be between 6 and 8 weeks before they could get me in to see somebody.
Whoa.
Did you have medical insurance, Austen?
I had very good health care through my employer. So yes.
Okay.
And how is your job playing into all this? So you say you got a new job. What is it that you were doing work-wise? Were you allowed to work with your condition, not knowing what it was?
It was an office-based job. I'm by trade a human resources professional. Okay. So an internal consultant at the biotech company, advising leaders on essentially human capital strategy. So that was not an issue. Flexible employer in the healthcare industry, could take the time that I needed to go and take care of my health.
That's nice.
Which is great. Always good to have an employer who gives you that flexibility. The 6 to 8 week time frame wasn't going to work for me. So I went back to my primary care doctor and asked him to see if there was another option. And so he was able to refer me to a community neurologist at a local hospital outside of Boston. And I still had to wait 3 or so weeks to see her, and got in second week of December in 2019. Okay. So again, January to second week of December. Over the course of that first appointment and the next subsequent week, she ordered an inordinate number of tests, blood tests, EMG, all sorts of tests, because I know she knew something was wrong, something wasn't right. I also continued to fall over those periods of time. So it was at the point where I previously had walked to work. I had to take an Uber to work pretty much on a daily basis, even though I was under a mile from I lived under a mile from my office.
Isn't it amazing how, just hearing your story, how we adapt as humans to whatever is given. And sometimes we don't listen to those messages. We just think, oh, I'm going to keep running because my knee hurts. Oh, I'm going to, I guess I'll now just use a cane, or I'll take Uber, or your story is so familiar, because my brother, who passed away from ALS, he was so healthy at the time that he came down with this. He had stopped drinking for the past year. He was lifting weights. He was working out vigorously. And then all of a sudden, and he thought he had a pinched nerve. So I'm hearing a lot of
I only said that when
story.
you're 35, that doesn't even enter into the equation.
Oh.
I mean, it doesn't.
100.
My
brother was in his 40s and it didn't register.
Right. We know that young people can develop ALS because we've experienced it, but I don't think the vast majority of the population is even aware of that. It's viewed as a old person's condition.
100%.
How did the new doctor deliver the diagnosis to you?
So after my EMG, I was in an Uber on the way back home, and I received a call from the neurologist, and she said, Austen, I don't have your official results, but I've seen the preliminary readout, and I am very concerned. I don't know what it is, but what I would suggest that you do is go home and do whatever you need to do, and then go to the emergency room. I really do want you to get this checked out and take this seriously.
Emergency room.
The emergency room. Well, you have to understand, we were right before I think it was Yom Kippur weekend or Rosh Hashanah weekend. And so I think she was concerned that I wasn't going to be able to get in to see a specialist as soon as possible. So referring me to the emergency room at MGH, I think that was a strategic move on her part.
Got it.
She knew that if I were to get some sort of diagnosis there, that would, in essence, let me jump the line at MGH and get in to see a specialist.
Okay, I get it.
Yeah. So went to the emergency room with my husband, Billy, and we were there for essentially 48 hours. Conducted all of the tests again. I saw pretty much every physician imaginable across the spectrum of different specialties. Mm-hmm. Went and got a MRI. They did the EMG again because they weren't able to get those results from the community neurologist. And about halfway through that period, in the middle of the emergency room, I was sitting on a bed that was wheeled into the middle of the floor. My husband was sitting in a chair next to the bed. The entire team of neurologists stopped by and basically said, we're very concerned. This is what we've been observing. There are still some tests that we need to conduct. Here's what we want to do. Sit tight. And I said to them at that point, doctor, I really would want to know, what is it that we're thinking that this might be?
So you haven't heard the 3 letters yet, whether it was you Googling, somebody mentioning it?
Well, listen, so let me take a step back. While this was all happening to me, when, the physical therapist was concerned, expressing concern, I started Googling, neuromuscular conditions. And, of course I came across MS and ALS. And I was like, there's absolutely
no way. Not me.
Yeah, not me. If it's anything, maybe it's MS. That could be the best possible solution here. And which, when you say it, that's a shocking thing to say. So fast forward back to the emergency room. The attending neurologist said to me, I'm really thinking that this could be ALS. He said this to me in front of 8 different neurologists in the middle of the emergency room, and I just lost it. I started shaking and sobbing uncontrollably. And it really did. It took me about an hour to calm down.
Not what you wanted to hear.
It's not. And to hear it in that way after not sleeping in the middle of an emergency room, just think of all of the the pressures and the stress that an individual would be under those situations, under those circumstances. So, we still hadn't confirmed it pretty much when we did the EMG again. They knew that that's what it was. So the end of day 2, took me into that dreaded room behind the emergency department and confirmed that it was indeed ALS. And what I was told is that somebody from the clinic would be calling me. They didn't have any information that they could share with me, that I should just go home and not Google the condition because, it might put me into a panic. And I was like, I was in a complete fog. I was like, I don't even know how I'm supposed to process this information.
And that's a whole episode in itself, because that is such a journey, as I know, because I went through this with my brother. So we would love for you to share, Austen, since clearly you're diagnosed at this point, share with us how moving forward it's challenged you. What's been some of the hard things for you that you would want to share with us?
Absolutely, happy to do that. I'll start with timing of the diagnosis. I think I just explained to you how stressful that experience was, but I received the actual diagnosis 2 days before my 36th birthday. And so happy birthday to me. What a wonderful birthday present to receive. And, quite frankly, I think psychologically, I'm a strong and driven individual, but to now, every year on my birthday, have to associate the condition that is robbing me of my physicality and my ability to be independent associated with my birthday. I mean, what a really terrible experience to have to live with for the rest of my life.
Austen, the exact same thing happened to my brother before his 44th birthday. It's so scary hearing the parallels and such a reminder. So I understand from the family perspective of
Austen,
exactly what you're talking about.
I went outside and talked to my creator 6 months before I got my diagnosis and asked, my life is quite interesting. What do you have in store for me? And a little bit more of a conversation, but 6 months later, I found myself in a wheelchair with a death sentence. So we appreciate everything that you are going through, because you, as I said before, you're holding the piece of puzzle for somebody else to answer a question. So tell us, what do you think's missing from ALS therapy right now?
Well, I think first of all, a cure. And I mean, I can't say that, strongly enough. I think McFinn, you are a very unique individual in that you've been able to reverse your condition. And I would love to talk to you at some point and understand how that sort of transpired for you, because I'm sure it's a very powerful story. But I don't think that most people get to experience that. I think despite the fact that, you go on every supplement, you try to focus on meditation and reducing stress in your life, it just doesn't seem to be enough for the vast majority of ALS patients. And so it's so critical that we continue to focus primarily on ALS and other neurodegenerative diseases like it, because there's so much that we don't know about the brain, how these mechanisms work, and why they even occur. So I think that's really what's missing. And to tie it back to everything ALS, I think that's what's so powerful about the work that we're doing here. The fact that we've prioritized identifying biomarkers on trying to determine what mechanisms within the body fail first, because that is really going to be the key to understanding how this condition starts, how it progresses. And, we have to understand those pieces of it in order for us to find a meaningful therapy. Because quite frankly, up till this point, the two drugs that are on the market, Riazole and Radicava, I don't want to besmirch all of the hard work and the passion that went into developing those drugs, but they're garbage and they really don't do anything. And, it's really been an exercise in shooting in the dark, right? We don't know how this disease starts, short of the genetic, mutation that is passed on. And if we don't know how it starts, we don't know how to treat it.
Well, over 90% of the ALS cases are sporadic, as you know,
Right.
and it's a heterogeneous disease. It comes on different ways. It has different pathways. And so, yeah, we hope with what we're doing, we can find subgroups of people, that are coming down with ALS and detecting it early, which will also lead to more tailored treatments for the different groups, because it comes on differently and it progresses differently, or it comes on for different reasons, I guess is what I'm trying to say.
Yeah,
So,
and agreed with that. And further to that, what I would say is we also, and this is where I get so passionate about this. I think a lot of it stems from my experience working in pharmaceuticals and biotech, but we also have to break the drug development paradigm as well, and we have to pursue treatments, research solutions that cannot and should not be bogged down in the bureaucracy and the paperwork that it takes to bring successful drugs to market.
agreed.
Right.
Now,
I'm
how do
taking
we
notes.
do that? How do we do that? We do that through advocacy.
Yeah.
We do that through lobbying. We do that through getting the word out there about this condition and how it wreaks havoc on not just the individual, but every person who touches that individual.
Yeah, and we're hoping to break down some of those barriers by just the simple fact that we got our FDA IRB approved study done in like under 6 months, or maybe it was even 4 months, something crazy. And we're on the fast track and talking with the FDA to, get our biomarkers validated. I mean, this is only going to help people like you or people who have not yet been diagnosed to get an earlier diagnosis, because we think that's key, actually catching it early. I mean, hearing your story took 8 months, but the good news about your story is once you got to a doctor, it didn't take long. Once you got to a neurologist, it was pretty quick. So that was positive, that at least there are a lot of professionals and doctors that do know what they're doing with this, because who knows, if you don't have access to a great hospital like you did, what do other people do?
Well, and that's the thing. I mean, we all, and I think we can fully acknowledge this, live in parts of the country where we have access to healthcare, world-class healthcare. I'm also very fortunate because I had insurance. What do people who live in rural, underserved areas who maybe don't have great insurance or don't have access to insurance at all do in these instances? And I really do truly believe that as a society, we have an obligation to provide that help and that guidance to everybody. I feel very strongly about that.
Have you found any trials to enter for yourself?
So yes. So aside from being on Riazole and Radicava, I think that's a pretty standard combination. I'm taking a multitude of supplements, and I think, not to give medical advice, but many of them can be found on ALS Untangled, and the efficacy and the effectiveness of those treatments. I think, with your doctor to determine if that'll work for you. I was in the Alexion Ultomiris trial, and unfortunately, in August, it was released that did not meet its primary endpoint. So that was a study that was terminated, and that was very disappointing. But I do think that the data that will come out of that study will lend itself to a tremendous amount of understanding and hopefully innovation in the types of drugs that are being developed at this point in time. The other drug that I just started, off-label, of course, is sodium phenylbutyrate, and that is that in conjunction with TUDCA is being studied currently in the Amylyx drug. So I'm doing that on my own, but we're hoping for some positive results there. And you know, the data from the phase 2 clinical trial was quite compelling. So fingers crossed that will continue, and the data will show that was efficacious.
Are
Well,
you
you'll have
having
to
any
keep-
physical reactions from taking those two products?
No. What I've noticed is that I've continued to progress. I mean, essentially from September of 2019 to today, you know, I've become a paraplegic. You know, I'm relegated to a wheelchair. I can't move my arms or my legs. I need full-time help from my husband to really do pretty much anything. You know, control my wheelchair with my head. But what I will say is very positive, and you know, we don't know what is happening, but my voice and my breathing and my swallowing are incredibly strong. In fact, last vital capacity, it was pretty much normal. So we have to hope that you know, the therapies that I'm on right now are playing a role in that.
Well, I'm sure you hold on to the fact that yes, you've lost use of many things, but you have your voice and you can communicate. And I wanted to ask you, you know, it sounds like Billy is a great supporter of yours. So if you could share, you know, if he's been a great champion for you, or if you have other champions or mentors that have been able to carry you through this journey.
Yeah, I mean, you know, I really would be remiss if I didn't mention, you know, the relationship that I have with Billy, and you know, the selflessness that really he's been able to demonstrate throughout this process. You know, this is a condition that has robbed him too, and you know, he really has had to put his, I don't mean he has had to put his life on hold, but he hasn't been able to pursue many of the things that he thought he would be able to in his life, really to take care of me. Now, that being said, on top of being my full-time caregiver, being my best friend, you know, being my partner in life, being the love of my life, he has also, I'm so proud of this, been able to successfully defend his thesis. So he got his PhD at the beginning of this year. He's currently writing a book. You know, he continues to be able to focus on the things that are important to him professionally and personally, and I try my best to support him through that as well as I can.
Oh, I'm so happy to hear that. You have to take care of yourself before you can take care of others. So Billy sounds like a rock star. We'd love to meet him and talk to him at some point.
Absolutely. I'll, you know, he tries to stay behind the scenes in these things, but I'll try to convince him. I think it'd be great for him to come and meet the team.
When somebody has ALS, it's the whole family has ALS.
100%.
So thank you, Billy. You know, the teamwork is just shows the humanness that each one of us has inside of us, that we really, if we're being cared for, we are really grateful. If we're giving the care, we're really thankful. It's really a beautiful ALS. They say ALS happens to really nice people. Well, Austen, you and me, baby, we're really nice people. We want to see you out of that wheelchair one day. Everybody's journey is different, and everybody's journey brings out the best in their friends, because you really see them show up, care, because you have something that they're going to have one day, and that's possibly they'll be leaving the planet. And that is one thing that all of us so much have in common, that we all better really be taking care of each other like we're all superheroes and we're all in love with each other, because teamwork is the key. Being alone is misery, and we are everything ALS. And that's, we came together because of a hard time for a lot of people. And now we're staying together because we're having a good time, feeling positive that we are making an imprint on all of you who need our help. We are there. So, my friend, is there anything else that you would like to share with us that comes from your heart?
So I'll just reiterate what you've just said, McFinn. I mean, I think, when you experience something as awful as ALS, I think it truly makes you appreciate and focus on what is important in life. And at the end of the day, it's family, it's friends, it's love, and it's that human connection. And it's so critical. That's what keeps us going. That's what forces us to focus on finding a cure for this condition, and that's what also compels us to share our stories, because we want to make sure everybody who's experiencing something as awful as ALS has all of the information, the love and support that they need throughout this very challenging disease.
Oh,
Thank
and
you.
really quick, before we only have a couple minutes, but Austen, what's going to be your vision with working with ALS? What roles do you want to take on? What challenges do you want to tackle?
Yeah, so I want to really lead the charge as a ALS patient who is an advocate, who leverages experience and industry knowledge to challenge that the medical orthodoxy in many of these areas. And I think that Indu and the rest of the Everything ALS team has done a tremendous amount to facilitate that process and really break down some of the initial barriers. And I know that as we continue to bring in folks who have the actual experience living with this disease, along with caregivers and loved ones who've experienced it firsthand, we're going to be able to transform the landscape here.
Beautiful. If there was one wish that you had for Everything ALS, what would it be?
Yeah, I think it's developing those partnerships with key opinion leaders, healthcare professionals, and patients across the spectrum, and really becoming a leading player, influencer, and change maker within ALS, the treatment of ALS.
Well, we're lucky to have you on board, Austen.
Thank you.
It's a pleasure to have you on our team. I think you add so much, and you're going to be tons of fun to work with too. So that's important.
Likewise. I feel the same way about you both. So.
Well, there you have us, folks. There's a view into our teamwork. And this is what is going to bring about the big change, because we brought the people together who have heart and soul, and we're not going to stop even when we get old. So just want to say thank you for joining us today. And to all of you who are watching this, thank you. Please spread the word that there is hope. And And we really appreciate you just listening to our podcast and to all of our information, because we do this because we do it from our heart, because we want to make a difference, and we want to make a difference for you. So thank you for joining our team, because we're all in this one together. Thank you. Thanks for joining us in our journey of exploration and digging deep into the souls of those affected by ALS and those working tirelessly to help put an end to this devastating disease. Your stories and work matter so much to us and to so many. Keep sharing and continuing to help further the research in ALS so we don't have to see another person suffer. Do you know anyone suffering from ALS? Are you a researcher, neurologist, pharma, or biotech company working in the ALS space? If so, we would love to hear from you. Contact us at info@everythingals.org. Thank you, folks.